Hi friends, welcome to the channel The Nurse. Here we are discussing about JIPMER and PGI Sangrur Nursing Officer exam preparation, questions and answers. So we will go to the topics. Before that, if you are not subscribed to our channel, please subscribe. And in this video, we will discuss around 15 questions including 2 GK. So we will go to the topic. JIPMER and PGI Sangrur series, questions and answers. First question. Anti-sterility vitamin is. It is an easy question. Anti-sterility vitamin is vitamin B1, vitamin B2, vitamin E, vitamin K. Correct answer is vitamin E. Why it is called anti-sterility vitamin? Because it energizes the reproductive glands. Hence, it is essential for reproduction. Usually, it is essential for the growth of testicles and production of sperms. So that is why it is called anti-sterility hormones. In the absence of germ cells to perish and seminiferous tubules in which the germ cells are produced to atrophy. So if the low vitamin E means it will reduce the production of germ cells. So that results in decreased sperm cells. So that is why it is known as anti-sterility vitamin E. Second question. A nurse is attempting to identify a patient's concerns. Which communication technique is most appropriate for the nurse to use? Silence, reflection, paraphrasing, open-ended question. Correct answer is open-ended questions. Open-ended questions like it is like how, why. It needed more explanation. The answer needed more explanation. So it will helps the patient to verbalize the concerns, main problems in detail. And we will check each of them. And first one is silence. Silence, it is not the most appropriate technique to identify concerns. It provides no direction to gather information. If you are silent, patient will tell something and will stop. And it will not direct or it will not make patient to convey all the details. And the second option, that is reflection. Reflection means it is not the most appropriate technique to identify concerns. With this technique, a feeling that the nurse identified in the patient's conversation is reflected back to the patient. This may not be an accurate interpretation by the nurse and it is more directive than another communication technique. So in this reflection technique, according to the patient's explanation, the nurse will reflect or reply. So this is your problem. So that according to the understanding level of nurse. So it will be more directive to the particular problem only. So that is why it will not helps to identify the concerns, all the concerns of the patient. So similar way, another technique is paraphrasing. Paraphrasing means it will after the patient will explain regarding something and the nurse will summarize what the patient was told earlier, and it will not helps to ventilate the whole feelings of the patient or all the concerns of the patient. So in this situation, we can use open-ended questions. Open-ended questions means it will help the patient if we are asking any particular term to explain why or how. The patient will explain in detail. So that will help the patient to ventilate the concerns or problems in a detailed way. That is why open-ended questions are more effective in solving the concerns of the patient during the communication. Third question, which one of the following vitamin is a photolabile vitamin? Which of the vitamin is an example of photolabile vitamin? Thiamine, riboflavin, niacin, cholecalciferol. Photolabile means in the presence of light, it will destroy. It will get destroyed. So correct answer is riboflavin. Riboflavin easily destroyed in the presence of light. Thiamine, it is a vitamin B2. Riboflavin, that is vitamin B1. Niacin, that is vitamin B3. Cholecalciferol, that is vitamin D3. So we will get more questions regarding these vitamins. Next question. The nurse should anticipate that the patient with what condition will most likely to have difficulty conveying needs verbally. So you need to understand this question, then only you can answer. The nurse should anticipate that patient with what condition most likely have difficulty conveying needs verbally. So here important term is difficulty conveying needs verbally. Options: receptive aphasia, hearing impaired, delirium, blind. Correct answer is delirium. So we will check each options in detail. First we will check the delirium. What is delirium? Of the four options presented, the patient with delirium is the most likely person to have difficulty verbalizing needs effectively. Why? Delirium is a temporary disturbance in cognition accompanied by incoherent speech and altered sensory perceptions. So delirium, it is a disturbance in cognitions. So thinking process is disturbed. So patient may be unable to verbalize the things. Delirium may be caused by variety of acute problems such as hypoxia. Hypoxia is one of the causes for delirium that will make brain damage and it will leads to delirium. Same time, metabolic problems also it will leads to delirium. That is hyponatremia, renal impairment, liver impairment. These are all will leads to delirium. So in the same time, other reasons, we need to check other reasons. The patient with excessive the patient with expressive, that is not receptive aphasia, has an impaired ability to verbalize a message. So mainly the aphasia, the two types of aphasia, apart from main types, expressive and receptive aphasia. And in expressive aphasia means the problems in expression, that is verbalizing the expressions. In the same time, receptive aphasia, the patient is having problem in understanding things. So in our question, there was option that receptive aphasia. So in receptive aphasia, patient is having problems in understanding, but there is no problem to verbalize or expressing things. So that option, that is why it is wrong. So receptive aphasia patient can verbalize the thing, verbalize his problems. Same time, hearing impaired patient also similar, like the patient has problems in hearing, but there is no problem to verbalize things. So that is why the hearing impaired patient also that option also wrong. In the similar way, blind person is able to hear or understand the things and able to verbalize also. But the person only thing is he is unable to see the things. That is, vision problem is there. There is no problem to verbalize. So that is why these three options are wrong. Receptive aphasia person can verbalize things. Also hearing impaired person also can verbalize things, but he has problem in hearing. Same way, blind person also can hear and he is able to verbalize his concerns. Fifth question, a biochemical condition of vitamin B12 deficiency can be obtained by measuring the urinary excretion of pyruvic acid, malic acid, methyl malonic acid, urocanic acid. Correct answer is methyl malonic acid. Vitamin B12 or cyanocobalamin deficiency, that is that impaired absorption in at the stomach level. So vitamin B12 absorption is helped by intrinsic factor. Vitamin B12 and folic acid is helped by absorption, helped by intrinsic factor. So if there is a problems in absorption in vitamin B12, it may excrete through urine. That is, usually we can assess it through the amount of methyl malonic acid. So protein particles will break down and it will make a coenzymes, cyanocobalamin coenzymes, and it will convert into methyl malonic acid. This methyl malonic acid will excrete through urine. If the amount of methyl malonic acid is high, means that there is a deficiency or vitamin B12 deficiency possibility is high because of absorption is not taking place at the stomach. So that is why methyl malonic acid urine excretion test it is doing to assess the vitamin B12 deficiency. For that, we need to collect a 24 hours urine. Then only we will get a adequate number of this methyl malonic acid level. A 24-hour urine sample to be collected for the test, and the normal range of methyl malonic acid in the urine, that is ranging from 0.4 to 2.5 micromillimole per millimole of creatinine level. Micromoles per millimole of creatinine level. So that is a normal range of methyl malonic acid. 0.4 to 2.5, that is used to assess the vitamin B12 or cyanocobalamin vitamin deficiency. The amount is high, means there is a chance of vitamin B12 deficiency, or there is a possibility of decreased absorption of vitamin B12. Sixth question, a patient with which condition should the nurse anticipate will need the assistance in making a decision regarding hygiene care? Moderate pain, altered reality, sensory deficiency, limited mobility. Correct answer is option 2, that is altered reality. So altered reality, or person with increased hallucinations or auditory delusions. So these are the patient has having altered reality. So this patient may have problems in taking decision regarding hygiene care. So important point in this question, that is the patients need assistance in making decision. Or it is the question is not asking to assist the personal hygiene, it is asking the patients need assistance in making decision regarding hygiene care. So altered reality patients have more problems in making decision regarding anything. It is maybe regarding hygiene care or anything related to the patient. Altered reality related to delusions, hallucination, or impaired cognition may impair a person's ability to make personal care decisions. So any kind of decision they will take with the difficulty only, or we need to give assistance, or we need to advise them to do like this or do like that. Like that, we need to provide an assistance. Seventh questions. This is a rich source of vitamin C. So which one? Rice, milk, egg, lemon. Correct answer is lemon. So usually fruits are known for rich in vitamin C. So in this, lemon is the correct answer. Eighth question. A nurse is assessing skin turgor in an older adult. Which side should the nurse use to assess for tending? Tending means that a skin turgor we will check that so the skin will go back to normal state. So that thing is known as tending. So in particularly here it is asked for older adult or geriatric patients. So options: hand, ankle, forearm, sternum. Correct answer is sternum. In older adult, we will do the skin turgor assessment on the sternum. Usually, we will check the backside of the palm for adult normal persons. So, in the older patients, there will be wrinkles over the body. So, sternum will be best part to assess the skin turgor for older adult or geriatric patients. pinching the skin over the sternum or anterior chest below the clavicle or forehead are preferred sites for assessing tending on older adults or geriatric patients. These sites are less likely to have wrinkles or edema that interferes with the assessment of skin turgor. So if there is wrinkles or edema, the skin turgor we cannot assess properly. So in the older adult, the anterior chest or over the sternum or foreheads are best sites for assessing skin turgor. Ninth question. The deficiency of which one of the following vitamin causes creatinuria? Vitamin E, vitamin K, vitamin A, vitamin B6. Correct answer is vitamin E. In the case of vitamin E deficiency, there is a chance for increased muscle dystrophy or muscle degeneration. So that will leads to increased creatine level in urine. So that is known as creatinuria due to the increased muscle degeneration or muscle dystrophy in vitamin E deficiency or tocopherol. Vitamin E is also known as tocopherol. In vitamin E deficiency, there will be increased muscle degeneration. 10th question. An unconscious patient has excessive oral secretions. In which position should the nurse place the patient to help prevent aspiration? Sims position, supine position, Fowler's position, Condor. So here correct answer is Sims position is best to reduce aspiration in unconscious patient. Sims lateral position. The Sims position is the most effective. The important word is most effective position to prevent aspiration, particularly in an unconscious patient, because excessive oral secretions will drain out the side of the mouth. In addition, these persons will be easily to maintain in a patient who is unconscious. So compared to other patients, Fowler's positions, Condor positions, supine positions, the Sims lateral position is most effective in draining the oral secretions. If there is excessive oral secretions, it will help to drain through the sideways of the mouth. So and it is easy to provide also for the unconscious patient. In Fowler's position also it will reduce the aspirations in some way, but it is not best for unconscious patient because sometimes it is very difficult to maintain the Fowler's positions. Patient will fall by sitting or patient neck will fold or it is difficult to maintain. So best position is when it is asked means it is a Sims position, Sims lateral position. 11th questions. Deficiency of thiamine causes beriberi, scurvy, night blindness, rickets. So correct answer is beriberi. Deficiency of thiamine causes beriberi, or another disease is Wernicke encephalopathy. Wernicke encephalopathy that is also used usually seen in alcohol withdrawal. Night blindness that is due to vitamin A deficiency. Rickets that is due to vitamin D deficiency. 12th question. A nurse is caring for a patient who is experiencing a laryngeal spasm. For which clinical indicator should the nurse assess the patient? Stridor, wheeze, crackles, rhonchi. Correct answer is stridor. The main symptom of laryngeal spasm, that is we can auscultate the stridor. It is like a snoring like voice. So laryngeal spasm is characterized by stridor, which is a high pitched crowning sound more prominent during expirations. It is caused by constriction of larynx. Laryngeal spasm is characterized by stridor, which is a high pitched crowning sound more prominent during expiration. It is caused by constriction of larynx. 14th question. Who was the second cricketer scoring 500 sixes in international cricket? Sachin Tendulkar, Chris Gayle, Rohit Sharma, Viv Richardson. Correct answer is Rohit Sharma. The first cricketer reached 500 sixes in international cricket, that is Chris Gayle. Rohit Sharma is in second positions. Then 15, the last question. The authority issuing digital currency in India. Google Pay, RBI, Phone Pay, SBI, State Bank of India. Correct answer is RBI or Reserve Bank of India. In December 1st, RBI introduced or issued digital currency in India as a pilot program. It is initially issued in main four cities. So after that, they are planning to introduce in all over the India and through 8 main banks. And in that, initially they have introduced in 4 main banks only. So after that, the step by step they will introduce to all over the India. So December 1st, that is the date. Digital currency introduced in India officially. The digital currency is issuing in India, that is Reserve Bank of India. So that is about today's video. So thank you for watching this video. If you have any doubt means you can ask in comment sections. So I will try to solve in there only. So you can ask your doubts. So thank you for watching this video and prepare well. Best wishes.